These are NMR Liproscience Lipoprofiles. These are what I obtain for patients to see what their LDL particle number is. The reason I do this will be demonstrated in the next two cases. I often find discordance between the LDL number and the LDL particle number. In this first case, a 69-year-old female diabetic on Crestor 10 milligrams and Zetia 10 milligrams with a hemoglobin A1C of 6.6. She has rheumatoid arthritis, which is a risk factor for heart disease. The best way to treat this patient to prevent heart disease is to put the patient on methotrexate. For some reason, this patient is not on methotrexate right now. Rheumatoid arthritis is an inflammatory disease, and this inflammation affects the coronary arteries. However, in order to do what we can do in the lipid clinic, we will check her LDL particle number and compare it to her LDL. Now, as you can see here, her particle number is 1015, which is higher than what you would think with the LDL calculated of 65 and the LDL direct of 56. The LDL calculated is not very accurate. The LDL direct is accurate, but there are many more atherogenic particles in this patient, as demonstrated by the LDL particle number of 1015. The patient's triglyceride level is pretty good. Her HDL is also fairly good at 58. Thus, this is a patient who is diabetic, and we don't really want to give her well call because her hemoglobin A1C is already 6.5. The well call would lower her hemoglobin A1C by 0.5. And we don't really want to give her Tricor because her triglycerides are okay. Niacin is a possibility, but her HDL is really pretty good and doesn't seem to be the best way to go. She's already on Zetia, so I think for this lady the best way to treat her is to increase her Crestor to 20 milligrams a day. This will decrease her LDL particle number, hopefully to below 750. She's high risk because she's diabetic. Here's another lady demonstrating discordance. She is a 82-year-old female on simvastatin. She's a diabetic, and her hemoglobin A1C is not very well controlled at 8.5. Her nuclear stress test was a poor study but normal in 2002. Now, this might be a good lady for well call because it would lower her hemoglobin A1C by at least 0.5. However, this lady has a slightly elevated triglyceride level of 169. Thus, this might be a good lady to give Tricor to because it will also raise her low HDL from 41, hopefully above 50. As you can see, this lady does have discordance, as her particle number is 1186 and her LDL calculated is 51. Normally, no one would ever think of adding on medications to this lady because her LDL is 51. However, once we get the particle number and we see that she still has a lot of atherogenic particles, we see that indeed there is discordance between the particle number and the LDL, and that we need to be more aggressive. Thus, this lady might be someone that we might put on more fish oil to make her small pattern of the LDL into the large pattern, and then add well call. However, I think Tricor might be best because of the HDL and because Tricor has such good advantage for helping microvascular disease.